So I'm Mark Haddad. I'm stepping in just as the temporary chair for this one meeting. And at the outset, I just want to note that in accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, May 8th, 2020, on the Zoom platform in accordance with the town's policy directive and guidelines issued on April 1st, 2020, as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call. We'll start with an attendance roll call. I will announce your name. Please reply. For members of the public, please unmute yourself when I've opened the meeting to public comment. So first, from the Board of Health, Ray Considine.
Present.
Jill Block.
Here.
Alma Healy.
Present.
Our Public Health Director, Susan Rask.
Present.
Karen Byrne.
Present. Can you hear me?
I
Yep.
can.
Okay.
And then is this, is Gabby White on also?
Yes.
Yep, present.
Great. And then it looks like there's one more participant. If we could just find out who's on. I don't know if it's someone from the public. Greg?
Yeah, Greg Royal. I'm a member of the Finance Committee, observer for the Board of Health.
Great, thank you. If you don't mind, can you just spell your last name?
Yeah, I'm trying to figure out. Oh, there we go. It just changed. Yeah, I was trying to figure out how to change it.
Got it. Okay, great. So the next discussion item is a discussion of the COVID-19 situation, the public health emergency, mandating face coverings. Susan, maybe you can outline for us this item and what the board is considering.
So a number of towns have enacted emergency orders mandating face coverings. And so I sent it out to you to see if this is something you would want to do. And most of you replied in the affirmative. I think, well, Deb was not in favor, and I'm not sure you were either, Alma, but 3 of you wanted to go ahead with it. And then we were sort of superseded by Governor Baker's order, which came out Friday, I think. So in some ways, a little bit of this is redundant, but what we drafted, it was the template they adopted in Needham, and ours is just a little more specific than Governor Baker's. I did add some other things to it that were not in the Needham template, and we can discuss those one by one if you want. In particular, number 7, roads, sidewalks, bicycle paths, and trails. We've had a lot of, we're trying very hard to keep the conservation areas open and the trails open. And as you know, a lot of people bike in Concord and run in Concord. And we've had a lot of complaints from the public, people biking past, you know, people who are walking and bicyclists or runners go past them without masks on, and or out on the trails, people don't have masks. So this would specify that if you're within 6 feet of someone on a trail or on a bicycle or while you're running, you must have a mask on. And so you must sort of be running or biking with the mask so that you can pull it up as needed. So I think that, that's kind of a good one. And then Concord Housing Authority had gotten some guidance from their state agency talking about buildings that have single entrances to many apartments, that people should be wearing masks in those single entry points. So this covers that. And it also prohibits non-essential visitors to the housing properties, which I don't, Marianne Nelson says it has not been a big problem. People are generally complying with it, but this would give us the authority to enforce it if that's what's needed. Mark.
Hi, Mark. I'm sorry, we can't hear you.
Oh, thank you. So just on that last point, I just wanted to make sure, it sounds like it's necessary for us to pass something with respect to the Concord Housing Authority if they are going to be able to enforce it. Is that right?
Yes. So it has not been a problem yet, but in case it becomes a problem, we would have the ability to, to prohibit visitors who are non-essential.
Okay. I mean, I think we should open up this topic for discussion, including whether or not we have a regulation, or if we alternatively, publish some kind of guidelines without having an order or regulation.
One of the reasons, I'll just jump in here. One of the reasons I thought that this was useful is that, in my experience, people want more clarification than the vague guidelines that exist. And I think what happened on the national level with the CDC regulations being very specific for a lot of different bodies like schools, houses of worship, restaurants, all sorts of workplaces, and then the president says, yeah, that's like too specific. I heard the backlash was that, no, we want that specificity because people are really struggling to figure out what's right and what's wrong. And so to the extent that this clarifies and gives people something to work with, I think it's really important because so many people are doing their own thing, and nationally, I'm saying, locally and statewide. I think more guidance is useful.
Could I I want to echo with Jill, Ray Considine here. I want to echo what Jill just mentioned. I think why I support this, I think for two reasons. Number one, our order or regulation exceeds the governor's by addressing the outside usage. And I've seen a couple things on a nurse neck or a nurse neck next door, or one of the listservs that we're on, talking about being on the trails and coming across people without any masks and being concerned about that. The other thing our order or regulation would address is signage. We would be requiring stores to post signs that masks are required for entrance to the store. Is that not right, Susan?
Yes. And Crosby's actually wanted the Board of Health to do that. I think they'd posted a sign that they wanted their customers to wear it, and then people were ignoring it, and they actually reached out to us and said, would the Board of Health please mandate it? It would help us.
Right. I have a question though. What would the difference between doing, providing guidelines versus a regulation?
One's enforceable and one isn't.
And then that enforcement becomes your responsibility?
Well, the next item on the agenda is designating the police staff as health agents so that they can enforce it. You may have known that they were out on the trail, like on the Bruce Freeman on bikes and on the nature trails on bikes this past weekend, kind of pre-enforcing the governor's mask order and just talking to people about social distancing, doing it in a nice way, but breaking up groups, talking to people. So it would give them the enforcement authority as well as us. Well, they'd be agents of the board.
So Alma, I'm curious what, if you thought previously that it was unnecessary, what you think now, or what you think the reasons are.
What I had decided was to have no visitors into the housing units. And as far as the trails are concerned, as long as there's social distancing, I feel a mask is not necessary except when they meet people. I can't see that I'm saying anything very different from anybody else here.
Right. Okay. And then Susan, do you know if Dr. Green had any other concerns that are worth mentioning?
No, as far as I know, she just thought the governor's order covered it, and we didn't need to go further, but I don't think she objects to the board doing this. I don't think she has specific objections.
Right. Okay. Yeah. I mean, so my view, I do think it's helpful guidance. I don't think we're doing anything that's inconsistent with the governor's order, but the governor's order doesn't have much specificity. And I think, there's a fine balance between certainly in open air when people are socially distanced, they shouldn't need to have something covering, but also I think people are nervous about passing and other things. And so I thought this draft was helpful in that regard, whether it's guidance or it's regulation. Either way, it's sort of spelling out the expectations, and it seems to me it makes sense to be regulation so that there is some enforcement, although I find it unlikely that there's going to be much actual enforcement so much as relying on people to do the right thing. I think we do live in a town where people generally want to and try to do the right thing, and so to the extent that we articulate it and that they are aware of it, they will be citizens that comply with it.
My thought is,
does anyone have? Sorry, go ahead, Alma.
My thought is, if we have regulations that are being enforced by either the Board of Health or the police, even though you say we're very obedient, kind people in this area, I still feel there's always the one that would want to reinforce and cause that determination to make sure that it is reinforced. So in other words, overplaying a part of regulation.
I think is it in the governor's orders, there's, or maybe what it was in this one, it does say something that, that it is not the responsibility of an individual to do that.
Right. However, I feel if we do have a police force going around enforcing things, many people will feel they've to help them. That's my thought.
Yeah.
In fact,
I mean,
I've already met
it.
it. Sorry, I've already met it on the trails. People lecturing about wearing masks and social distancing, taking it on themselves to be the police.
Yeah, and it's if you just read the news, I mean, in other parts of the country, this has been a very controversial topic, and there are towns where they implemented things like this and then undid them pretty quickly because there were some protesters or sort of vehement objectors and things. I mean, I do think it's a tricky balancing act, but I think as a Board of Health, we still should be promulgating what we view as sort of the appropriate behaviors for maintaining public health. I think Alma will probably have that, people like that, whether or not we have a rule about it. And I think,
of course,
in some respects, I think our rule is, I was just going to say, in some respects, I think our rule is helpful because it talks about not needing a mask on trails and in the open as long as you have one available so that you can put it on if needed for passing or congestion, right?
Mm-hmm. So I certainly am in agreement with that. I have no trouble with that.
And I think that's what I've generally observed, that people tend to put it on and act responsibly when they come to one another. And I think just if it's written as a guideline as opposed to a regulation, then at least it just helps people gain that understanding and doesn't put us in create that burden of enforcement and altercations or whatever. But it just helps people understand it a little bit further.
I apologize, but the computer crashed on me, so I'm on my iPad now. Sorry, I lost part of the meeting. I'm back though.
That's right. Welcome back, and it's being recorded, so you can catch up later.
Mark?
So Jill, I wasn't sure, your last comment, was that suggesting that you think guidelines would be better than regulation, or were you just sort of talking pros and cons?
You know, I guess it's pros and cons. I mean, yeah, pros and cons. I guess I could live with it being guidelines as opposed to regulations. Because, you know, the state rules are already there, the state laws are there, but it really just, you know, just helpful specifics. I think that's what people want and need. Although I do think that the things that we added about, what was it? It was number 2 about food service establishments wearing masks when handling or preparing food. That's not something that's in the governor's, and that just seems like a no-brainer to me. But
well, it seemed like a no-brainer to me too, Jill, but we keep getting complaints about people getting takeout and they're observing food handlers not wearing masks.
so then that would argue, that would, for me, then weigh towards the regulation as opposed to the guideline, right? But then it's an enforcement thing, and who's inspecting?
And the other complaint we got is people who are delivering food like DoorDash, those people aren't wearing masks. So they're showing up at people's doors, carrying food and handing it over. And we can't control DoorDash. I mean, so for instance, I've been talking to Sammy Basil at Sorrento's. He doesn't know who's picking up for themselves or picking up for DoorDash. He doesn't know it's a DoorDash order, but he knows that, you know, but he knows that some of them are DoorDash and those people are not wearing masks. Or he only finds out it's DoorDash when they pick up. And he was like, well, we're wearing masks and these people that are delivering are not wearing masks. Just feedback.
I guess I would, I guess I'd like to argue for or propose that we move towards the regulation. Only, well, for a couple points, but mainly I think the guidelines become ambiguous because they're not certain, and so some can adopt it, some cannot. There's no mandate behind the guideline, so that in the DoorDash situation, you know, they can elect to use it or not use it, or a guideline for people on the trails, they can elect to or not to use face masks while passing people. And I think it also offers sort of a consistent standard, and particularly for signage, so that all stores are required to put that in, and it's not just up to the store owner to make that decision. So I don't see any of the provisions terribly onerous, and I think they just provide more certainty, and I think that's what people are looking for at the moment.
I guess my only thought about it is, oh, go ahead, Mark. Go ahead.
No, go ahead, Susan. I was just saying I agree.
I mean, I guess my thought is, as we start to reopen the state, when the governor starts to issue guidelines, I think wearing masks is going to have to be part of those guidelines to allow us to reopen businesses. So I think we're going to be living with this for a long time, I suspect.
So if indeed we all voted that we would like it to be mandated, and so the follow through of that is, how enforceful will the police be, or us lot, for instance, in making sure that these regulations are carried out? So we've seen the abuse of that, obviously, in the news, and that's the bit that is a concern.
Yep. I mean, I think there's a real commitment on the part of the police force to be as friendly and nice and educational about this as they can be. And I think that, you know, they'll be out on the Bruce Freeman Rail Trail and the conservation lands. And when they observe people not doing it, they will ask nicely that people put on a face covering. And I'm guessing most people will comply with that. I don't think anybody wants to make this a big law enforcement thing, because that will backfire. And
Well, that was the concern.
I mean, we need to educate people and get people into a new mode of thinking about how to operate in public, because this is going to go on for a while.
Right. And I think part of that education is the specificity that this provides. So.
Right. Right. We're just we're retraining people now how we interact in public.
Okay, so I think that's sort of the general discussion. I guess my question would be, are there any provisions in the draft that people want to discuss specifically or have additional comments on? I know everyone had a chance to give Susan separately one-to-one comments, but not necessarily on the most recent version. And there's at least one typo that I'd emailed you, Susan, that should get fixed. But
Okay.
that was it was my typo. There's a where that should be WEAR, but it says WHERR.
Okay, we'll look for that.
But I guess I'd open it up to other board members if there are any of these provisions that you want to discuss in more detail.
I'm comfortable with them.
I'm comfortable as they're, pardon me, as they're written.
And I agree with the same.
Right. Okay. So given that, I'll entertain if someone will make a motion to approve these regulations.
I make a motion to approve the regulations as written.
I second it.
And
All in favor, I will do a roll call. Ray Considine,
Yes.
Jill Block,
Yes.
Alma Healy,
yes.
and Mark Haddad, I also vote yes. So the motion is approved 4-0. Susan, why don't you talk us through the next topic, which is the designating the police as agents?
I will. The one last thing I wanted to add about this is, do we want to have the town manager sort of do this as a robocall to let people know? Well, I mean, we'll at least put it out on news and notices. It's his call whether he wants to do it as a robocall, but if you ask him, he probably would.
I think that would be useful to get the information out as quickly as we can.
I mean, I know he tries not to inundate people with the robocalls, because then he thinks if you do too many, people stop answering their phone. But some people do not have internet access. I have gotten complaints from people that they aren't getting enough information because they don't have internet access.
Okay.
Yeah, I mean, it seems to me that it makes sense to, I guess I would leave it to his final judgment if he wants to do the robocall or not, but it seems to me it makes sense, because my biggest concern about passing any regulation here is that, the 8 of us on this call are going to know about it, and Dr. Green and nobody else.
Can we also put something in the Concord Journal?
Yep. Good idea.
The other thing that's been happening, Susan, you probably know this, and those of you with kids, but Dr. Hunter, the superintendent, has been passing along all sorts of good, just general information about use of parks and use of town land. I mean, it's been a good channel for anyone with school children to get information. So I suspect that if someone asks her, she will certainly pass that along, at least to all parents, which is a big part of the town.
That's great. I'll write it up as a bulleted list and she can get it out, and we'll get it out on news and notices and social media. So, okay.
Does Concord Patch pick this up off the town website? Is that how they do that?
I think so.
Because otherwise, if not, alerting them to this as well.
We'll put it out as a press release. They'll
Okay.
get it that way.
Good. Okay. And could you remind us when the effective date would be?
The way we wrote it, it would be 6 o'clock tomorrow morning, but we can put any date in that you want.
Sounds reasonable to do it as soon as possible.
Yeah, I agree. I think 6 o'clock tomorrow morning is perfect since, it's a weekend. But, Saturday, Sunday is probably the highest risk
Right.
days, at least for trails and things.
Yep. Okie dokie. Great. We ready to move to the next topic? Agenda item?
Yes, please.
Okay. So Chief O'Connor reached out to me. He received something from sort of his law enforcement group suggesting that boards of health appoint police officers as health agents so that police officers can enforce whatever needs to be enforced regarding social distancing and masks and everything else like that. And we would write a letter to the police asking them to be our agents. I think it's a great idea just because they have, staff 24/7 all over town. If they observe something that shouldn't be going on, they can enforce on our behalf. So I would recommend that you appoint, let's see, what's the language? Agents, let's see, get the appointment in writing.
Yeah, it would be appointing them as agents of the Board of Health.
Right, all sworn officers, supervisors, and commanders of the police department as agents. So there's a little question about who appoints health agents in Concord. Under state law, you have the authority to appoint health agents. We have a strong town manager form of government where he gets to appoint the health agents. I'm not really sure which it is, but since we were meeting today, I thought I would have you vote on it. And then if he wants to make the actual appointment, that's fine. But at least he would know he has your support. Or if he decides that it's up to you to do it, you voted to do it.
Yeah, so I mean, this sounds like a great idea to me. I don't know if there's any other discussion.
My assumption is that it's like the only thing, right? Because Susan and Gabby and Stan, like you're not out and about in the town these days, right? So what alternative is there?
Right. I mean, I'm here 4 days a week, usually in the office. Stan is here 1 day a week. Gabby's here 1 day a week. I think that will start to pick up as we start to reopen things.
Mm-hmm.
I mean, Gab's going out and doing a lot of, if we have restaurant complaints or food service complaints, she's doing that. But I mean, we're not walking the trails. We're not patrolling the streets.
Mm-hmm. So it seems like a no-brainer.
Yeah.
That we need the police to do this.
I'm thrilled they're willing to do it.
Yeah.
Absolutely thrilled they're willing to do it.
Right. And do compliance checks with cigarettes too?
That'd be awesome.
Is there an end point to this or a termination point? Is it open-ended or how do we handle something like that?
Let's see. I guess you would just,
So
the appointment will be for the duration of the state of emergency pertaining to COVID-19 or until rescinded by the Board of Health, whichever happens first.
One other question. Does this apply enforcement to Board of Health members in any way?
Well, I think technically you always have enforcement authority. You're the Board of Health.
So us as individuals could be enforcing this on the trails.
That's my question. We could do that?
I mean, yeah, technically, but I wouldn't do that if I were you.
Not a way to make friends.
Okay.
I mean, if you want to write tickets, Ray, I can give you a ticket book.
No, thank you. Okay.
So The only question I have, maybe it doesn't really matter, but that on the duration and state of emergency, there's a Massachusetts state of emergency and there's a town state of emergency, and most likely they'll end up being the same, but I do think we should be clear. To me, it should be the town's state of emergency that we.
Okay. So I'll
assume.
change the wording to the town's declared state of emergency.
That makes sense.
Okay.
If there's no further discussion, I'll entertain a motion to approve the appointment.
I'll make the motion to approve the appointment of police officers and Board of Health and Enforcement.
Second.
And I say yes.
I'm not
Great.
sure.
All in favor. I'll do a roll call again because that's our rules that we've been given. Ray Considine,
Yes.
Jill Block,
Yes.
Elma Healy,
Yes.
and Mark Haddad. I'm in favor as well. The motion has been passed 4-0. Susan, do you want to talk us through the next item?
Okay. Can I just have a question on the last one? When does this go into effect? Immediately or tomorrow morning or?
I will write the police, we have to write the police a letter telling them, so we'll probably get the letter out Monday.
Okay.
I mean, I can let the police know you voted it today. In fact, I
Mhm.
will, because that way they can do that this
For the
week if
weekend.
they want to.
Good. Okay.
Okay. I don't have too much to say about the next agenda item, which is the town meeting options. And maybe I'll kind of hand it over to Jill, who wanted to put this on the agenda, because you know more about it than I do. Jill?
Well, I don't know much about it other than the memo that you all received, and I received it. And Greg, I'm interested that you're on this call as well. My husband Wade Rubenstein is a member of the FinCom, and he received this memo, which came, from the was sent to the select board and town manager from Carmen Reese, our town moderator, about options for protecting the public health. So I guess it was sent to FinCom because there's financial implications for each of these scenarios, but in my mind, there's equal public health implications for all of these. And I was a little disturbed that it didn't come to us. I don't know whether, Susan, you had any conversation with any of our liaisons or anybody from Stephen Crane or anybody. So it just was this random thing that I happened to live in the household where somebody received it. So anyway, I just thought that, all of these options have their challenges for, everybody. And there's some real public health implications. So I just thought that we might have some input on this. We might have some feelings about it. And that's why I sent it on to Susan for sharing with all of you. So I don't know if any of you read it. I don't know what the channel is even for responding. I mean, the channel would be obviously letting Carmen, Stephen, and the select board know. But anyway, we weren't asked officially. That's a problem in my mind. And anyway, just wanted to get other thoughts on it.
Jill, I think you raise a very good question. Who ultimately gets to weigh in on the decision regarding town meeting and the safeguards? Is that the moderator's role solely? Is it the select board's role solely? And I was surprised to see this. It looks like there's a moderators association that's been discussing the implications. I'm not sure how much public health input the Moderators Association has been using in coming up with these ideas. So I would agree with your concerns.
Yeah, it's disturbing to me.
Yeah.
I mean, maybe our approach is really to respond. Like I just started writing in each of these some of my thoughts, and maybe what we do is we share. We discuss some of those concerns and maybe just share it in a response to them with our input, unsolicited input, but concern. I don't know if that's the appropriate approach to take or not. And I don't know whether you read through them all, if everybody read through, and have any ideas.
I did read through them all, and basically they are taking into account the aspect of protecting the health. In all of them, they do pretty much talk about the cleanliness of the area and the various restrictions implemented. And there was not one aspect greater than the other in my mind. They all have their various issues, and there's no quick answer to this.
Mm-hmm. Yeah. I mean, one of the ones that stood out to me was option 3, the parking lot with voters and cars. I was thinking about the vans coming from the COA and Newbury Court, which often bring a lot of the senior citizens to town meeting. And I'm thinking, well, that's not happening. And how would that population be able to participate, which is probably the most well-represented population at town meeting anyway. So,
Good point. Yeah.
I looked at that one and I was like, well, that's, if everybody had a car, that would be really nice, but that's just not realistic. When I look at it, option 4, I think has the best option in terms of protection of individuals and opportunity for a large turnout. Probably the most cost intensive of all of them, but from a public health perspective, probably the best. So,
right.
And that's kind of where I was going with my feedback, just to kind of weigh in with some of our our informed opinions. Any other thoughts on it?
I had two reactions to it, or two thoughts to it. I think 4 does make sense. Number 1 makes sense if we had multiple locations within the high school. But I had this idea, and I don't know whether this is legal or not, but whether the town could issue a lottery for the number of participants, limit the number of participants each night by lottery. That if you were interested in going to town meeting, you'd submit your name, and by random choice, 100 names would be chosen, or 150 names that would be chosen each night. And you could only go one night of town meeting if it stretched out over multiple nights. And it would only be one representative per household. So that you'd have, you could limit it to, in some ways, a representative town meeting in the sense that there may be only 150 participants. And then you'd be able to put 50 of them in each one of the locations in the high school, the gym, the cafeteria, and the auditorium. Mm-hmm. And then adhering to temperature checks, social distancing, the sanitizers, etc., and masks required, of course. You wouldn't have a full turnout. You might have a shortened warrant, as it's been suggested, and only essential items be brought up that are requiring legal action before the end of the fiscal year. But you'd be able to have, by random choice, people who wanted to come, but not in large numbers. So it might be, in some ways, a hybrid between number 1 and number 4. That was the thought I had. I don't know whether choosing representatives to come to town meeting by lottery is even legal, and whether you could restrict it to 1 member per household to attend. But those would be 2 suggestions to try to minimize the large gatherings and maintain social distancing.
Right.
Yeah, so my guess, Ray, I think it's a good idea, but my guess is that wouldn't hold muster as far as the structure of our town meeting laws and the sort of one citizen, one vote type of structure. I mean, to me, I think the public health concerns, if we're not able to do option 4 with enough locations to have everyone that wants to participate, then it seems to me like the delay option is the better option, although I recognize that may not be ideal. But it sounds like and this is really maybe more a question for Greg and the select board and everybody else. I mean, I think from a public health standpoint, it seems to me like Jill makes a really good point that whatever option they decide to pursue, they should probably check with us before implementing it in case there are concerns. Like, I think it's probably less our job to say, you know, do one of these 4 things, and more our job if they pick one of them that we have concerns about to then raise the concerns about the path they're choosing to go down, right? Because there's all sorts of other reasons why they're going to decide one way or another that are outside of our purview.
Mm-hmm.
Right.
Maybe is it appropriate to respond with just a letter to Carmen and the select board and Stephen Crane that we would like to be able to weigh in with whatever their decision is, and just, you know, give our you know, our informed guidance to it. You know, not that it's really not clearly it's not our choice, but that we would like to be kept informed and given an opportunity to provide input.
Makes sense.
Mm-hmm.
Susan, have you been consulted at all separately on any of this, or no?
No, I wasn't even aware of it until Jill brought it to my attention.
And as I said, that was like a coincidence that I just, you know, live in a household with somebody that got it. Who just, you know, when Wade got it, he was like, do you know anything about this? Was really surprised that we knew nothing about it. So, anyway. So is that,
okay.
Go ahead,
Do
Mark.
we, I mean, one thought around it would be, do we feel that the Board of Health needs to have direct input on it, or that it would be sufficient if we made sure that they gave Susan an opportunity to comment and give input on it? In other words, some of this to me is a little bit of the, you know, execution on a specific event with specific sort of more tactical concerns about how exactly you do it most safely, versus necessarily something that, you know, we're going to, as a board, slow down their process and decision making around. And I don't know what you think about that, Susan, as well, but.
I mean, I think everybody's challenged by what to do, you know, and they're trying to think of as many options to make town meeting. We have to get town meeting done at a minimum to pass the fiscal year budget, and everybody's trying to think about how to do it and do it safely. So, I mean, I don't know. It's up to you how you want to handle it. Whether you want to weigh in now in support of one option or just say pick the option and then we'll work with you for how to make it safe. I don't know.
That would make sense, the latter.
Right. I would agree. I
Yeah,
mean,
that's sort of where I would lean to.
yeah, I mean, it just seems like
Sorry, Joe.
Susan, you know, just as, you know, the town's health agent really should have, you know, an ability to check in on this one and weigh in, you know, and bringing us in if you need that, Susan. But
Okay.
You should seem to play a role.
Yep.
So do you want me to communicate that to the town manager? Do you want to write a letter to the town manager? What would you like to do?
Well, I think a letter to the town manager, so we memorialize this and we go on record of requesting your involvement in whatever decision is made in terms of protecting the public's health.
Right.
Okay.
Yeah, I agree.
Mm-hmm.
So do I.
Likewise.
All righty. It sound good to you, Karen?
Yeah, it doesn't, I don't think you need to take a vote on that,
No,
do you?
no, I don't think so.
No, I don't think so for a letter. I think it's okay.
Thank you.
Okay. Any other discussion on that before we go to the next agenda item?
Nope.
No.
So Karen sent in our packet the schedule of upcoming Board of Health meetings, as well as the minutes from December, January, February, and March.
Lots of them.
Yes. Any questions on the calendar or on the draft minutes?
I have a question on the calendar for you. So we have a meeting scheduled still on the 19th that we're going to keep on the books just in case we need to check in, or we may cancel later after we hear the governor's guidelines. I don't know.
I thought that was cancelled. No.
Well, I did too, and then I don't remember if it was Ray might have mentioned to keep it on the books, and Dr. Green said maybe we have to hold off just even for another week to see if anything changes. You want to do that? We can cancel it quickly enough. I just don't know if what the availability of everyone will be.
Nobody's going anywhere.
Well, I don't know. You might be all rule breakers on the trails.
Fine with me.
Okie doke.
Yeah, I think we hold off considering the 18th as one of those dates.
Yeah. Okay.
Yep.
At this moment in time, do you want to do it earlier if it's on the Zoom platform, or do you want to wait? I mean, that's the other thing, the time. I wasn't sure if you want to just keep it to our regular time, or do you want to try to do it earlier?
If it's a Tuesday, is it?
Yes.
Yeah.
In the morning, I would not be available.
Okay.
Yeah, I mean, at least for me, generally speaking, it's
Better.
easier to keep our general times because we're still, you know, this is my first of many Zoom meetings today.
I'm sure.
Sure.
I have to take it back. This is my second. I already had one from 8 to 9.
Boy.
before this.
Chris, are you
Um,
on? Can we ask Chris, like what, Chris, are you there?
Yeah.
So if we kept it to a 7 o'clock meeting, like we can do the Zoom again, or that'll work now? You'll update me on whatever that policy is to get a Zoom
Yeah.
meeting going? Okay.
I'm sorry. So which day and time is this?
It's going to be Tuesday, the 19th. It's scheduled for 7 p.m.
That's fine.
Okay, great. Thank you.
Thanks.
Okay.
Yeah, and I would just say I think keeping it on the calendar for now, and then I would just leave it to Dr. Green to decide if she
Mhm.
thinks we should, you know, move forward or not with having it.
All right. Thank you.
Any questions or comments on the minutes before we vote to approve them?
No.
Nope.
Okay. I'll entertain a motion to approve all 4 sets of minutes.
I agree.
You need a second.
Somebody second?
I second it.
Okay, I'll do a roll call again. All in favor, Ray Considine,
Yes.
Jill Block,
Yes.
Paul Mahealy,
Yes.
and Mark Haddad in favor.
Thank you.
Okay. So I'm trying to find my agenda. Board member reports. Does any board member have another report they'd like to share?
No, not from me.
Okay. The staff report, Susan.
Okay, so a lot has changed since the last time we met, as you all know. So I thought I'd report on where we are with the case count, the long-term care facilities, the community tracing collaborative. So as of today, this just in from Tricia, who I have to say, I can't say enough good things about Tricia and Kathy Castle doing our communicable disease investigation. They've been working 6 days a week, tracing every contact. They have just gone so far above and beyond. I can't say enough good things. So Tricia says, as of today, we have 138 total cases in town. 42 of them are regular sort of residents and 96 from our assisted living facilities and skilled nursing facilities. So that's actually pretty, you know, in terms of regular residents, that's actually really great number. We should feel good about that. You may have heard, I don't know if you've heard about the situation at Care One. It's not a great situation. They had an outbreak which got started on the dementia unit. So most of the skilled nursing facilities and assisted living facilities since the beginning of March have had people staying in their own rooms with food delivered to their rooms instead of congregate dining and everything like that. But of course you can't do that on a dementia unit. You know, people, you can't explain to people why they have to stay in their rooms. They all sort of, most of the rooms are clustered around a common area, and the people really, you can't keep them in their rooms. You can't keep face masks on them. It just isn't doable. So they had an outbreak that got started on the dementia unit. And then I believe they were maybe a little short of PPE, as everyone was in the beginning, and maybe a little short staffed. And so they, although they should have cohorted the staff to the dementia unit, I think some of those staff ended up having to work elsewhere in the facility. So at the moment, they have a total of 78 total cases of COVID. It's really high. Their total bed capacity is 135, but they've been operating at about a little over 100 for most of this. Currently, they have 34 people who are positive. They have everybody cohorted now. They have a positive wing, a negative wing, and an unknown or waiting for test results wing. They've had 16 deaths. They've had a total of 42 staff who have been infected, 19 of which have returned. We've been having conference calls every other day with DPH, with their hospital infection control person, as well as the epidemiologist. And almost all the nursing homes at this point are having actual inspections, in-person inspections from DPH, and Care One was scheduled to have that this week, and I will talk to them at 3 o'clock, and hopefully that has happened. So I can tell you that the hospital infection control person who's been on the calls has questioned the head of nursing in detail about everything and has not suggested anything that they should be doing that they haven't been doing. I think it's just been a bad situation, as it has been at many of our nursing homes and long-term care facilities. Rivercrest, New England Deaconess, they've had a total of 22 cases with 7 deaths and 8 staff testing positive. And Concord Park, I think, has had 2 or 3 positive cases. So,
Susan, did that include staff at Concord Park, or just those were residents? Do you know?
I think it was 2 positive residents. They may have had 1 positive staff member. I'd have to check.
Okay, thanks.
But they've kept it under control really well.
Susan, what did you say for Rivercrest in regards to positive?
22 total.
Okay.
I don't know how many of those are currently active or have recovered. They've had 7 deaths,
Right.
and 8 positive staff members who've tested positive.
Thank you.
So that's
Susan?
what Trish and Kathy and I have been really putting time into for the last couple of weeks.
Is that 23 deaths we've had here in town? Or is it higher?
So 16 at Care One and 7 at Rivercrest. I don't think we've had any sort of regular resident deaths.
Okay.
And I will say, in fairness to both of these facilities, the people that have passed away have all been on either hospice or do not resuscitate. I mean, they've been people that are probably in the last months of their lives anyway.
Right.
I mean, very sick people.
Susan, can you talk a little bit about the contact tracing that's been going on?
Yeah, so as of this week, we're now transferred over to the DPH Partners in Health Community Tracing Collaborative, who all the cases now automatically go to them for tracing, other than the clusters which we keep, which of course will be the nursing homes and stuff, which in truth is the majority of it, but that's okay because we need to be on top of that anyway. So we'll see how that goes. It's just finally gotten transferred over this week where it automatically goes to them unless we say we want to keep it. And Trish and Kathy are in Maven every day. They know which ones they need to keep and assign to the clusters that we're working with, which are really just the 3 nursing homes. We did have an outbreak at one of the Minuteman Arc group homes, but that's under control as far as I know. A number of staff got, I mean, here's what I think has been happening. The staff who are asymptomatic bring it into the nursing homes and group homes. Many of these people don't just work at one facility, they work at multiple facilities. And then they go home to housing situations where they have other housemates who are also working similar jobs or are working as retail clerks or you know, don't have the luxury of staying home and sheltering at home and working remotely. And I think it's been really challenging for all the nursing homes to have these staff that work like 2 shifts here, 2 shifts there, maybe a private shift in somebody's home. You know, I can't think of a worse scenario for spreading disease. It's just been really challenging for the nursing homes. The lack of PPE was a challenge, and the staffing has been a challenge. I mean, they've had many nurses who've said, you know what, I don't want to work in this. I don't want to sign up for this. So then they have to hire nursing agencies to fill shifts. So now you have more outsiders coming in. I will say that Rivercrest New England Deaconess passed a policy a number of weeks ago that if you work for them, you could only work for them and not work anywhere else. And they're making up the financial difference for their staff for the foregone shifts at other facilities. I don't think Care One either had the corporate decision to do that or the financial wherewithal to do that, maybe, I don't know. So they've had a lot more sort of nursing agency staffing coming in and, you know, moving around. So I think that accounts for a lot of it. I did one of the group home investigations for one of the Minuteman Arc ones, and you know, for 4 residents, they had 8 staff that worked the various shifts, but those people also work in other group homes. They do private duty care, you know, it's just a real situation that spreads disease. So I'm happy to have the Community Tracing Collaborative, which is hiring people with other language skills. I mean, a lot of the people I talked to, clearly English was not their first language. It was hard for me to understand what they were telling me sometimes, and hard for me to know if they understood what I was telling them about quarantining. It's been challenging.
Susan, what is the testing procedures right now for employees of nursing homes and long-term care facilities?
So Care One has had all of their residents and staff tested. Rivercrest has been sort of, when they have an outbreak on a unit, they've been testing that unit and the staff. I mean, everybody's trying to cohort stuff as much as possible, cohort staff with patients to the extent that they can. Concord Park, actually, I think they had the National Guard out. They did, and they tested the whole facility, and fortunately they came back low. For Care One, the National Guard sent all the test kits and they did it in-house. But I guess the National Guard is they're not sending test kits anymore. The National Guard's actually going and doing it because they felt some of the tests weren't being done properly. Mm-hmm. So different facilities have handled it different ways. Was that your question? I'm sorry.
Yeah, no, that's okay. Yeah. You know, it's a surprise. We got a call because my wife used to work for the town of Lexington. And we got a call last week saying that they were opening up a community testing facility for any resident or employee of the town that wanted to be tested in Lexington.
So Emerson Hospital reached out to us, and we were going to set up a drive-through testing facility for them at the high school. And then I guess the level of testing that is being asked for was not worth setting it up. Although they did make an agreement with us that they would test any of our essential employees for us that we wanted to, send over to them. And we have sent a few people over. I don't think, we have a long list now of places you can go to get tested. So I don't think the physical location is impeding testing at this point.
Good. Yeah. I'm not suggesting that we do that. I was just making that as an observation.
Yep. And then I talked with Deb Green yesterday, and there's a Concord resident who is willing to financially pay for the cost of doing 1,000 antibody tests for town residents. So I'm working with her, and I'll be working with the town manager to see what we might be able to set up to do that. I guess he and his family were very sick in February, and he would like to know if they had it, and he's just curious. He's somehow affiliated with Partners in Health, and he thinks they could use the information just to better understand how many people have actually had the disease.
Can you repeat that? He's going to financially what?
He's going to pay for the testing. He's offered to pay for up 1,000 tests.
Antibody tests.
Antibody tests to see how many people have had the disease.
Wow.
So we'll see if we can get that set up. And that's pretty much what I've been doing since we saw each other.
Not much, huh?
We thought you were at Walden Pond. Your background is letting you down.
I assure you I'm in this hemisphere, even though it looks like fall. So that's what we've been doing, and Karen's been working away. We've been trying to, keep essential functions going as best we can. People still need to install septic systems and sell houses, and we've been trying to keep all of that going. We haven't been doing routine food service inspections, but we've been responding to complaints. They're opening golf courses as of today, so Gabby will work with the golf courses to make sure they follow the governor's guidelines. And I anticipate that, after May 18th, when we start to get some guidelines for reopening, we're going to be very busy working with businesses to make sure that they're following the guidelines or working with us enough to create safe ability to reopen, whoever gets to reopen.
Crazy.
And then we have to decide whether summer camps run, and the health directors are begging DPH to let us know that, and we have been told it will not be till May 18th. So whatever guidelines we get on that, we'll work with that to make sure the camps follow them.
And the beaches.
And the beaches.
And the beaches.
And the swimming pools.
And the pools.
Right. So that's kind of how my coming months are shaping up.
Hey, Susan, I'm curious, how has the communication been from DPH? When this first started, there were, those weekly calls, and it looks like maybe those went away, or maybe now they're just for public health directors, but I'm curious.
No, we're still having the Tuesday calls with DPH, and then the governor set up the COVID command center, and we're having weekly Friday calls with them. So I'm on at least 2 conference calls a week. And then everybody that uses Maven, there are 2 Maven conference calls every week, so that Trish and Kathy are on those calls. So there's quite a bit of communication, and all the guidance comes out by email, and the state DPH really does have a good website with all the guidance. So it took a little while for it all to gel, but it pretty much has now.
Great. Okay. Sorry, Karen, what did you?
Good job, Mark. I was looking at the time. You're going to get to your other call.
Oh, yeah. Wow.
Get you out of
So,
here.
Does anyone have other questions for Susan? Okay. I do want to open the meeting briefly for public comment. I know Greg's been on the call, maybe just listening in, but in case Greg had anything he wanted to address, I'll open it now.
Nothing here. Thank you very much, though. I think you guys are doing a great job.
Thank you.
Thank you. You know, Susan and Karen, great job as always keeping up on all of this. This is unprecedented time, so very, very impressive. Does anyone have anything else they want to address before we conclude the meeting?
Hi, Mark, could I just say something quickly?
Sure.
I'm sorry. So my name is Chris Carmody. I work in the town manager's office, and we have been doing this Zoom support for our Concord public committee meetings. And all, you know, these meetings are recorded and available on the town's website. On the risk of speaking on Stephen's behalf, during this period, I think there's a greater feeling of social isolation, and it's just a great resource to be able to see, especially the select board when they're talking about public meeting or anything else, that there are discussions going on, and that, you know, there's a lot of information being shared virtually. And so just want to remind people that there is still a lot of discussion and information being shared, and that resource is available on the town website.
Thank you.
Sorry.
Great.
Thanks, Chris. Okay.
If there's no further discussion or business, if someone wants to make a motion to adjourn the meeting.
I move that we adjourn the meeting.
And I second
Do I have a second?
that. Yes.
All in favor? I think we have to do roll call again. Ray Considine,
I in favor of adjournment.
Joe Block,
Yes, I'm in favor.
Paul McGeely.
Yes, I'm in favor.
All right, Mark Haddad, I'm in favor of concluding the meeting.
Good job.
Thanks, everybody. Have a good weekend.
Thank you so much, everyone.
Bye,
Good to see you
everyone.
all.
Have a nice
Bye.
weekend.
Everybody.
See ya.
Bye.